Okay, so a chiropractor is a doctor that examines the spine. And we examine the spine for what's known as a subluxation. And a subluxation is a number of segments in the spine that aren't moving well together. So they could be slightly malpositioned, or they could just be the motion of those few segments just isn't working very well together. So what we do is we look for an area of the spine like that, and then we're going to adjust that area. The symptoms of a subluxation would be that it would feel tight. It would feel like that area of your back isn't moving well. It might feel like there's muscle tensions, muscle spasms. There are other symptoms of a subluxation, and those symptoms could come anywhere throughout the body. That's what's so complex about chiropractic, is that chiropractic is about adjusting the spine, but the way the spine is set up, the vertebra in the spine protect the spinal cord. And coming out from the spinal cord, in between those spinal segments, are nerves. And those nerves go all throughout the body. So low back, they'll go to the abdomen. The bowels, the bladder, they'll go down into the legs. A lot of people know about sciatica. So sciatica is a nerve that's in the leg, but those nerves originate in the low back. So you could have a problem in the low back. You could have a subluxation in the low back, and that subluxation is actually going to be giving you symptoms in the legs. You could have a subluxation in the low back, and it could be causing constipation because those nerves that come out from in between those vertebrae in the low back go to the bowel. So by treating the subluxation in the low back, by adjusting the low back, the potential consequences that you can have as a chiropractor throughout the body are really numerous, too numerous to discuss, but that's a possibility. Now, if you were to adjust the neck, the nerves in the neck go to the arms, they go to the hands, they go to the wrists. They also go to the diaphragm to help you breathe. So potentially adjusting the neck could help the diaphragm, which is a muscle, move better and could help you breathe deeper. If you're adjusting the neck, you could also affect carpal tunnel because the carpal nerve that's in the wrist originates in the neck. So carpal tunnel can come from the wrist, it can come from the elbow, but it can also come from the neck. So if you adjust a few segments in the neck that lead down to that carpal nerve, you can potentially affect the carpal tunnel and make that better. So the effect that we can have as a chiropractor is throughout the entire body. And that's because it really affects the nervous system. It's those spinal nerves that are coming out in between the vertebra that are really affected by the adjustment. And it allows them to transmit their impulses all throughout the body much better than they were when it was a segment that wasn't moving well, when it was stuck and it was spasmed. That nerve that travels through those tissues isn't working optimally, and so when we adjust those segments in the spine and we help that nerve to transmit its impulses a little better, then the whole rest of the body can potentially function better.
Thank you for watching A Wise Way. Subscribe to stay updated, share to pass the knowledge, or view our other videos on the left.